Joining us now, National Review's Michael Brendan Dougherty. He's author of a new piece in National Review where he's talking about how if you want to have people get vaccinated, that the unvaccinated cannot feel disrespected. This is part of a big thing that we've talked about in today's show about how exactly to reach people who have such low institutional trust and more. Michael, we really appreciate you joining us. Thanks, man.
Thank you so much. It's a pleasure to be here.
Absolutely. Let's just start off with this. What do you think are some of the pathologies that we have seen as to why about 44% of the U.S. population does not want to get vaccinated right now?
Well, I mean, the overwhelming reason is the simplest reason, which is they don't fear COVID as much as they fear the vaccine. People who are enthusiasts for the vaccine may find that very silly or innumerate or misinformed, but millions of people decided long before the vaccines were approved that COVID was overblown for them, that this was something that mainly affected people over 65. It wasn't very serious, especially for younger people who are generally healthy and fit. And so they don't want to take the risk of a vaccine. Whatever that risk may be. They've been told there are very few adverse effects noticed, but they worry about things like long-term effects. And they know from their own reading and study that, of course, a new vaccine for a novel disease in the midst of a pandemic, it can't have full FDA approval, it doesn't yet, and it can't have long-term studies on its effects. And so many of them are just making a calculation that they feel is completely rational, that they don't want to take this. And some would go further, and they feel that because public health officials have occasionally lied or misrepresented the truth about risks, that they've, covered up potentially the lab leak theory and tried to censor that. They feel that many of them feel that there's something maybe a little underhanded or sinister at work in the vaccine effort. And they've also find, I think, what caused me to write the piece was that in just talking to the vaccine skeptics in my own family, among my friends, I noticed that none of the public health apparatus was addressing their stated concerns, right? It would just be these kind of messages about what we already know about the vaccines. And they're concerned about what we don't know. And they find it creepy that millions of dollars is being spent reaching out to them, and yet they're not being spoken to like adults with real concerns. And like I said, in the piece, I think one thing that would go a long way towards reestablishing trust is just acknowledging some of the concerns, that it's normal to feel this way about a new vaccine, that it's normal to wonder about long-term side effects, that no, we can't know with 100% certainty that there are no long-term effects from these vaccines, but you could try to explain in a medically plausible way why that's such a low probability event. Now, I suspect that that's something true and something public health officials could do, but it's beyond my competence as a pundit to do that. So it's on someone else to give this explanation. And I know for many people it feels like lowering themselves to address people they deem to have made an irrational choice already. But if you want vaccines in arms, at this point, this is kind of what you have to do. And if you treasure your political animosities or your disdain for people who don't have the vaccine more than the campaign to vaccine, well, maybe that's an indicator that you're not as afraid of a larger unvaccinated population being out there as you think you are. Maybe you're okay with it.
Michael, there's been a lot of focus on white conservative men in particular and the high levels of vaccine hesitancy there. If you look across, and this is something, a graphic that we've shown a couple times now on the show, if you look across racial groups, it's actually African Americans overall who have the lowest vaccination rate. And there seems to be, a sort of, through line between what your income level is and what your education status is and whether or not you get vaccinated. Of course, African Americans disproportionately lower income in this country. So the reasons that you're giving here, based on your experience talking to people in your circle, your family, your friends, et cetera, do you think that those reasons are specific to sort of white conservatives, or do you think that they go across racial groups?
Well, in general, I think the feeling that vax-resistant people or vax-hesitant people have that is common is this idea of, I don't fear COVID as much as I fear the vaccine, right? It's as simple and primal and elemental as that. But for different groups, there can be different mixtures of, or different reasons for simple mistrust in public authority. Whether it's, for white conservatives, they feel like, they may feel like public health officials endorsed the BLM protests last summer when there were still restrictions on outdoor activity, and they may think these people really don't have my interests at heart in some fundamental way, and there's something dishonest at work. For Black Americans, it may be an experience of something where they've heard about, their mother or their sister seemingly being treated differently when she delivered a baby at a hospital than other patients. They may hear other stories of how Black people are prescribed pain medication in different levels than white people. They may hear all this and just simply distrust the medical establishment or all establishments. And you have to speak to that as well in your public health messaging campaigns.
It's interesting, Michael. I bizarrely saw a lot of criticism against you on this piece from a lot of people in the center left. Who were like, if Michael was real, he'd be like, Tucker Carlson's full of it, and he's killing people, and the Fox News Rupert Murdoch machine. I obviously know, I think your response is correct, but what do you say to those critics? Because maybe people are here saying the same thing, but like, you have a responsibility to call these people out. What do you make of the argument?
Well, I think I disagree with Tucker, but among my friends and family, nobody even has a cable television subscription. They don't watch Tucker. They get their information from social media. That it's shared laterally, usually across Instagram would be the most common thing. Like people sharing Instagram stories of someone having a strange adverse reaction, and maybe a dissenting doctor that is hyping this up. Maybe they follow, Martin Kulldorff of Harvard, who was, a pioneer in designing vaccine safety systems. And he's saying, well, not everyone has to get vaccinated. That's a bit of a superstition. So the sources of where they get their information are various. But the big thing is, I would say, is this is a demand side issue. Average people aren't... it's not like misinformation comes through the internet and just hits them. Yep. It's they have a gut reaction, a gut feeling and response about whether the COVID itself is overblown or whether public health officials are being manipulative in some way. And they have this fear, the fear of the unknown. And listen, they know, for instance, people say like, okay, well, just research the history of mRNA theory, which goes back 50 years. We've known theoretically that this should work for a very long time, and now it's here, and so you should celebrate that. And they would just reasonably say, like, yes, that's a theory on paper, but science is about empiricism. So this is a live experiment. And some of them, one of my best friends from high school said, I am willing to be the control group. And that's his attitude. So you have to address those fears first, and the misinformation would take care of itself.
Yeah.
So, Michael, let me ask you on that. I think we're all on the same page that, some of the comments from the Biden administration recently are deeply troubling and authoritarian, and the idea that the government is going to tell all the social media platforms that you can be like internet death penalty for this or that person at their choosing. not good, right? But let's put that aside, okay? Would it work? Let's say that, the Biden administration goes and these 12 people that they keep talking about are spreading so much of the misinformation. Let's say they get them offline. They're no longer able to share whatever vaccine misinformation they're sharing. Do you think that would work to help reduce the fears of some of the people who continue to be vaccine hesitant?
No. I mean, censorship is the thing that I hear most often about as setting off people's spidey sense that something is sinister about this.
That's a great point.
It totally increases their distrust. And like I said, what they want to hear are some of the most common things. So, for instance, the U.S. government runs the Vaccine Adverse Events Reporting site, VAERS. Its data is public. It's available for everyone. And during this vaccination drive, there's just been this huge surge of reporting across it of adverse events. Now, this is something you don't have to be a doctor to enter an event. I mean, people have said they've turned into the Hulk or other things. There's some really silly stuff on there. But lots of vaccine skeptics look at that site. That's not misinformation. That's government-hosted information. And no one in the government is really contextualizing it for them. And so all that's left is for Alex Berenson or Tucker Carlson to give context to that information. MIT found in a study of people who dissented from public health during COVID that they tended to use the same exact data sets as proponents of public health orthodoxy. They just interpreted it in a different way. And so my view is that to counter, what you deem misinformation, you don't need censorship. You need patient contextualization. You need more information, better information. Censorship would have the exact opposite effect that they want.
And so, Michael, I think this is where we were having a debate on the show today, which is that to what extent, here's what I was saying. My basic posit was this. I was like, instead of talking about Facebook, look at the actual populations, lower middle class, blacks, whites, and Hispanics. Find people who have credibility within those groups and send them through the Deep South or wherever, where you see hotspots and people with vaccinations. But what Krystal was rightly saying is, I don't know if it worked. We pointed to a past Frank Luntz focus group, so take that with, the biggest grain of salt you can find. But they were like, look, I support Trump, but if he told me to get vaccinated, I wouldn't do anything about it. Do you think that it wouldn't have any impact on my decision? Is there a way for quote-unquote influencers, people with credibility and more, to message this? Or is it more of a bottom-up phenomenon that we're seeing?
It depends how those influencers go about it. If it's something completely independent where it's literally just like a well-known internet celebrity just volunteering their experience. Maybe, some of them don't get vaccinated and then they get seriously ill and they share that story and it goes viral. That would be more effective than something that is branded as a government ad, because then it feels like that's taking advantage. I mean, I think you'll find, and what some studies are starting to indicate, is that vaccine hesitant people, some of them do end up taking the vaccine. They really are telling the truth when they say they were waiting to see what would happen. And some of the key influencers for them turn out to be their GP, right? They're a doctor they've known for years. And it's a problem for America because lots of people don't have a GP. And it may be one reason why the UK has had so much success in uptake is because the NHS system, whatever you want to say about it, people can find their GP and they can get information from someone they know that has a medical background. When they're just looking at Tony Fauci telling you that, your 3-year-old has to mask outdoors or something like that, I mean, you might just think like this is some kind of fraud is at work here.
Appreciate you making a case for universal health care.
The case for the enemy.
Thank you. I agree. Here's the other thing that I've been trying to figure out that we were talking about earlier. It's a big question mark for me. So if you've got about 44% of the adult population that hasn't even gotten their first vaccine, do we have a sense of like what percent of that is just superposed over my dead body? No one can talk me into it. There's absolutely no way. And they have an ideological position that this is not happening for them and their families. What percent of it is still in that movable, like either I need to have a little more information, I need to wait a little longer and see how this goes, or I think there are still some people, given that we don't have paid time off in America, who, taking a day off of work or potentially a couple days if you have serious symptoms is a real logistical hurdle. Do we have a sense of what the percentages are, and if there are still a group of people who are ultimately movable?
So we do. I mean, roughly, as you said, 40, a little bit over, say they're hesitant for one reason or another. And in that group, you would say 10, maybe as low as 9% are totally and finally and immovably opposed, although that could be as high as 20 in some surveys. So you still have another 20%. You would still get well over, the Biden administration's goals or Fauci's stated goals if you convinced people that said they were movable. And some people are going to move between these categories as this proceeds. They may, if the Delta variant or other variants turn out to be less deadly in themselves, not just because of the vaccine prevalence, you may have more people moving into the camp saying, no, I'm never going to take a vaccine. I'm probably safe. If the fall, there's more hospitalizations and deaths, surge in, deep red parts of the country, I think you'll see people move from the totally opposed camp into the camp of saying, oh, this looks more dangerous than I thought it was. I'll take it. So it like I said, you ultimately, for most people, you really have to touch on that elemental, do I actually fear COVID or do I fear the vaccine or the unknown? And for some people, it's a tricky matter, too, because some people find it easier to accept danger from COVID or from nature or from God, right? This is just what fate inflicted on me. Whereas the choice to make a vaccine feels like you made a commitment and you might feel more foolish if something bad happened to you and you had this intuition that it might, right? So you would feel guilty for not following your gut. So people are complicated. So you have to address them patiently.
No, absolutely. Michael, you're also an astute observer of European politics, and a lot of the American left has noticed what happened in France. And there's a dual narrative here, which is that France says you have to have a vaccine if you want to board a train, go to a restaurant, basically everywhere you go. It's like the literal nightmare of the Turning Point USA conference, where you actually need a vaccine passport to live your life. At the same time, they got 2 million signups for a vaccine appointment the day after Macron made that announcement. I mean, is that analogous in any way to American politics?
So it's possible there are a significant number of vaccine hesitant people who maybe they don't fear COVID, and maybe but they don't fear the vaccine so much that you couldn't hassle them into it with a restriction or coercive measure that makes their life more a pain in the butt. So, but what you're essentially admitting there, or what you're seeing there, is that there are people who are not doing this for health reasons at all. I mean, they're literally just saying maybe I don't fear either of these outcomes all that much, but if you raise the price, I'll do it. So, if policymakers want to try coercion, I actually do think that would be more effective for some of this unvaccinated population, but it may radicalize opposition from people who are really determined. And you're seeing that in France, where there was even a Holocaust survivor that's been put in the media in France saying this is like the Holocaust in some way, this coercive measure, which is a hysterical thing to say. But you will see that as well. I think in America, with our political temperament and tradition, I would proceed very carefully. And I would also note that Israel, which has super high cohesion, a pretty high level of trust in government institutions, their vaccine passport program was abandoned. It was they invested a lot of resources into it, and then it kind of fell apart. So, other governments are going to try this. Like, I know Ireland is going to try it. France is obviously trying it. The European Union has talked about doing something across the continent. I'm skeptical that this is going to work. And in America, it might not even, it just may not fly to say that there's now a semi-permanent rider on the Bill of Rights that has to do with your medical status. That may be struck down in courts. And honestly, I would advise pro-vaccine advocates to avoid that fight now, and that maybe this isn't the pandemic to go to war with anti-vaxxers. Maybe you want to save that bullet for an even deadlier one in the future.
Right.
To be contrarian here, what some people on the other side would say is like, look, we already require vaccines for kids in order to attend public schools and in certain other settings. So what's the big deal with adding one more to the list?
Well, I know my friends and family would say, well, like, we still don't have FDA approval for this vaccine yet. This is still an emergency use only.
By the way, can I ask you about that? Why?
Sure.
Like, isn't that something they could get around to at this point, making it beyond an emergency use authorization?
They are close, and they could probably speed up the process even more. However, and I actually do give FDA credit for this, they are conscious that if they speed up the process dramatically, or they could look like they're cutting corners in some way and then undermine trust in final approval. And I think their hope is that, like, hey, listen, like, 1 billion people have taken these vaccines now, and you're just not seeing people like hospitals filling up with people just because they took the vaccine. Like, there is I think they're hoping that if there's an element of this that's a public experiment, I think they are hoping that the results are positive and that's evident. So they could speed it up, but like I said, the argument from the vax hesitant and resistant would be, hey, some of the vaccines we require for children, they're for diseases that are far more deadly than COVID, especially deadly to children. And they're much longer tested than these vaccines. I mean, I don't know how you get a better test than 1 billion people, but but we are, but they, it's correct. It's not a medical setting over the long term.
I hear that one probably more than anything, Michael, which is that, it's emergency use authorization. I'm not going to part of the experiment. I've said that a million times. I'm like, look, 1 billion people have gotten it at this point. Half of U.S. adults, and it doesn't seem to be enough. Right. So I'm just skeptical that the FDA thing would actually do anything.
Yeah.
Right?
Well,
they just find another reason.
Yeah.
Well, and like I said, there is, people are combining that with, that's what they tell you. But in their Instagram, they're seeing things like, there's a surge in miscarriages or some other thing that's happening. So, like I said, there's a lot of information that kind of has to be contextualized for people to accept this, I think. And remember, COVID itself, this totally obliterated people's sense of normality in the last 16 to 18 months. Things that you never thought you'd see in your lifetime in the West just became normal. And so I think, people are still struggling with that. And it's naturally a time that raises your level of fear. And if you don't trust the authorities, in this kind of a time, you're going to be more distrustful of authorities.
We covered some of the innovative, like the vaccine lottery things, the free beer, free donut, all that stuff, which seemed to have some short-term positive effects in terms of states were reporting they saw a surge in number of people signing up for vaccine appointments. Do we have any evidence that those were actually effective over the long term to induce people to get vaccines?
It'll still take time, but it does. The result in Ohio with the lottery was pretty good. That was definitely a smart improvisation. But it also tells you that, it either tells you that, most people are innumerate and have a very hard time understanding remote probabilities. Or it tells you that for a ton of vaccine hesitant people, they just don't feel urgency either way. They don't feel urgently in danger of COVID. They've been living their life more normally than people that were fearful of COVID and were waiting for the vaccine. So they don't feel like they're restricted as much. So they just don't feel urgently one way or the other. And yeah, maybe these inducements can push them over the edge.
Yeah, I'm really curious, I guess, at this point, what is going to work? I mean, and that's kind of how I'd like to wrap up this conversation. Like, where do you think and look, I've said this on the show, on the margins are actually important. If you convince 5% of U.S. adults more to take it, that's 1 million people. Like, that's, even more added herd immunity, 1 million people more who aren't going to get sick, or at least very sick from COVID. That seems really important. Like, what do you think where we're at right now, realistic ways that we could make this work?
I mean, realistically, I do think, well, I actually have to say, I would have said a couple weeks ago, hey, it's all over but the shouting. But we are just observing in the UK and now in the US, we're observing this Delta variant surge in cases that is leading to some increase in hospitalization. But, over time, I trust what Nicholas Christakis wrote in Atlas Arrow. Over time, we should expect that COVID itself will become both more transmissible but less deadly. And so, we're kind of racing against the clock. But at some point, like in a way, nature produces its own vaccine, right? I mean, nature will produce its own form of herd immunity. So it's just a matter of whether we can get all of the most vulnerable protected before that eventuality. So, I can't tell you. I mean, Fauci has moved the percentage of people it would take
Right.
to reach herd immunity a few times, and who knows if he knows. So I wouldn't dare speculate, but I do think it would make a big difference to get 5 to 10% more of the total U.S. adult population. I think that would make a huge difference in the final death toll. And public health officials, they've run into this demand wall now. They've got to start trying something new.
Yeah, they really do.
Interesting insights. Really grateful for your time, Michael. Great to have you on the show. Thank you so much.
Thanks, Michael. Really appreciate your time, man.
Thank you. It was great.